going to be the instructions for the Micro-Z Mini and the Everyway Dual Polarity sock. When you receive your package, you will receive 2 devices, 2 socks, and 8 tubes of cream. You're going to go ahead and bring out 1 package that has the Micro-Z Mini in it, 1 package that has the sock in it, and the 1 tube of cream. From there, you're going to want to start with the device. You'll notice up at the top there's a perforation on the package. You're going to use that, pull it back, and that will open it, and then you'll be able to get into the package. Inside the package will be a black mesh bag that will have the device, a battery, and a black strap. For now, we can set the black strap to the side. We're going to go ahead and put the battery in place. You're going to want to take the battery out of the plastic bag. You'll want to open the device by holding it in your left hand, and you can either put it towards you or sideways, and you're going to pull back on the long, thin tab straight back to open the device. Then once you have it open, that piece of plastic, as you see, will come completely off. You'll want to go ahead and put the flat side to the spring, put it in place, and put the plastic back. All right, we're going to go ahead and set that to the side for a second and go ahead and get our sock out. This also has a perforation at the top, and you'll go ahead and get that open, and the sock, the dual polarity sock will have both a red and black snap cover. When you receive this sock, the black will be on the top and the red will be on the bottom. We actually reverse it during treatment, and when we take these off now, you'll see that when we go through the full treatment. So be aware at night when you go to do your other sock that you do need to have the red on the top and the black on the bottom. We are going to put them onto the end of the device. So you're going to take the red wire that came from the sock and put it on the end of the red wire on the Micro-Z Mini into the receptacle on the pigtail. You will also take the black wire and put it on the end of the black wire. They can be a little tough to do. Please try to ensure that you cover as much of the silver as possible. We are now going to run through the device. You're going to hit the middle button on the device. One time it will say P1 on the screen. P1 is only a 30-minute treatment. We are only using that for titration purposes. So you'll be hitting it a second time to P2, and that is your 8-hour treatment. Most patients will be doing an 8-hour treatment at night, but you can do the 8 hours during the day if necessary. And as long as you're getting your 8 hours within a 24-hour period, that's what we're looking for. Once you're on P2, you're going to then use your right up arrow key, and you're going to increase the voltage to 50 volts. This is the common voltage we use for peripheral neuropathy and diabetes. You will be trained by your clinical educator per your diagnosis for the specific voltage setting that you will need. This is just an example, again, of diabetic neuropathy. It does take about 1 minute for the device to start flashing back and forth, which lets us know that it is locked out for safety. What's going to happen is the device is going to start flashing between the P250 and the time it's counting down from the 8 hours, so it will show 7 hours and 59 minutes. When it starts flashing back and forth, it is locked out, meaning that if you were to hit the up or down arrow keys, you're going to see the voltage does not move. If you do need to release the voltage for any reason to bring it up or down, you hit the middle button one time, it will release your voltage and you can start moving the voltage up and down again. If you wait another minute, it will lock out again for safety. So it does that repeatedly for safety. So that is how you run the device. We're going to go ahead and shut it down so we can put everything together. You're going to hold the middle button for approximately 5 to 8 seconds, and that will shut your device down. Now we're going to take our tube of cream. We're going to unscrew the top of the tube of cream, take the silver seal out of the way, and then replace the cap. Now you're going to go ahead and take your shoe and sock off and bring your pant leg up to your knee. And you're going to start by applying a nickel-size amount of cream to cover the top of the foot, the bottom of the foot, and the toes. Depending on the size of your foot, you want to ensure that you cover all areas thoroughly, the entire foot, And then you're going to take another nickel size amount or greater if your leg is larger and cover the rest of the leg to just below the knee. Please ensure that you cover the front, back, and sides of the leg. Once you have the sock in place, you're going to know how far up the sock goes, and you'll know where you can stop applying the cream for future. You may now go ahead and apply your sock once all of the cream is in place. Now we're going to take the black strap and we're going to put that around the white stripe. The black strap is what holds our device, so you're going to notice there's a square end, a rounded end to the device, and that one side of the strap has black fuzzy Velcro on it. You'll also note that there's a pocketed area near the rounded end, and that's where we're going to be holding the device. So you want to ensure once you have that strap in place around the white stripe that you move that in between the silver snaps so that you can have the area to hold the device. So when you start this, you're going to lay the black square end down first with the soft side facing out, come back around the back side with the rounded end, overlap the square end, and then stick it to itself. You want to make it snug enough that it stays up, but not so tight that it's uncomfortable. Once you have that strap in place, you want to ensure that the pocketed area is between the silver snaps, and that will allow you to put the device in once we get it plugged in and turned on. Next, you're going to plug the red lead to the top and the black lead to the bottom. So we say red to the heart. So always remember, red is on top, black is on bottom. From there, we're going to turn the device on. You're going to hit the middle button one time. It's going to say P1. We want to go to P2, so you'll hit it a second time. Then you can start increasing your voltage according to what the clinical educator says. Once you start to see the device flashing back and forth between the setting and the time it's counting down, the 7 hours, 59 minutes, then you can unsnap the red lead from the top, and then you're going to bring it from the bottom up through the space where the doubled material is. And then you're going to want to bring the device through as well, sideways. That will ensure that the wires are coming out on either side of the strap. Once that is in place, you can go ahead and snap the red lead back in place. Now your device will be securely inside the strap. If you do have any issues with the snaps coming off while you're sleeping, you can put another sock over this sock, or if that is too uncomfortable or hot, you can cut the foot off of a sock and just put the top portion over that area to keep everything in place. And this is how you would put on the Micro Z Mini and Everyway Dual Polarity sock.